Hi, my name is Adriel William, and in today's video, I'm going to talk about bench exam preparation and Adex preparation and other practical exams that are conducted in the US. So, on number one thing that I want to talk about is what is a bench exam. So, schools in the United States, dentist schools, they they not only conduct interviews, but they also make foreign trained dentists like me to perform restorative procedures before they give us admission. And the reason they want to do this is because they want to make sure the foreign trained dentists they are getting into the school should have a uniformity of skill set, that all of these individuals, 10, 15, 40 people, should have equal level of competency, and they should be able to pass the ADEX exam later on, the licensing exam, because somebody might be really good on his didactic part or theoretical part and might have passed all the exams and score really good on the TOEFL, but when it comes to his practical skills, he can't make a class 2 or can't do a crown prep or doesn't know the anatomy of a molar tooth. And then he might be in a lot of difficulty in the practical realm and he won't be able to pass the practical licensing exam as ADEX, and that will cause more problem to the school. So over time, what the schools did in the United States, that they started conducting these practical exams called bench exams. So from my personal experience, I would say if you want to score good and you want to be good in your bench exam, regardless of what country you're coming from, because I know in some countries, dental students are doing a lot of crown prep and some students are not able to do many crown preps in their dental school because their school or their country's economy or dentistry system is much more inclined towards ortho or surgery. So if you're preparing for American schools or for a bench exam, make sure you start doing crown preps, class 2s, class 3 early on. The earlier you start doing them on typodonts, the better it is, because this is a hand skill. It's just like writing, it's just like playing guitar. The more you do it, the more your skills will develop, the better you will be. And nobody can beat practice. But the second thing I want to talk about is if you want to practice, make sure you practice under the right guidance where you're able to get some feedback from a good mentor or a professor. And I would say in US, getting your preparation course from somebody like Stevenson, Dr. Stevenson would be a great place, because it's not just about prepping the crown, but also evaluating your preparation according to American standards is very important. And I'll talk more about evaluation of crown preps as well. But you need to practice a lot and you need to get feedback from a good mentor. And people usually say, hey, can I send you some pictures to see my crown prep? Well, pictures won't be able to justify or explain what kind of preparation you're doing because it's a 3D image and pictures are a 2D image. So what I'm trying to say, crown preps are a 3D object, and when you send a picture, that's 2D. So nobody can evaluate it well. So make sure you physically go to a dentist, to a mentor, to a professor, and see how they evaluate your prep. Second of all, I would say use something called petty stents. I'll try to put the video up here. Use those to evaluate. And one of the things I've learned in clinical dentistry in the US, that the biggest mistake most people do is under reduction of the occlusal surface. So the occlusal surface or molars or the incisal surface, labs complain a lot that the dentist didn't remove enough surface from the occlusal level, so they can't put on a crown, and that's a very common mistake. And how do you fix it? You fix it by using the right instrument to measure. And I think for dental schools, using a putty stent is a very good way to measure your crown preps. Beside this, if you're going for a bench exam, here are a couple of suggestions I'll tell you. Regardless of where your bench exam is, make sure you arrive in that area, that city, about 2 to 3 days before. Why am I saying this? Because if you think you're just gonna land on the last night and sleep 8 hours and wake up in the morning at 5 and go and perform 8 hours of practical exam and you will pass, well, that's gonna be pretty hard for you. Trust me on that, because there's a lot of stress and you want your body and your mind to be relaxed on that day. And how do you do it? If you're traveling from far away, make sure you travel 2 days before and climatize or assimilate in that city, because if there's a time difference, if you're traveling from India or Pakistan and going to California for a bench exam and your time zones are different, your brain is not going to do a good job. So make sure you arrive like a day or two earlier. And I know it's going to cost you money, but from a physiological point of view, I would say being relaxed is the biggest key. So you practice all these days, you prepare your mind, you prepare your hand, but in order to perform good, you need to have that good sleep. So arrive in that area a couple of days before and just relax, walk around, go see the city, enjoy some food, but relax. All right. Second thing I'll tell you, in most of these exams, including Adex, you're gonna be waking up at 5 or being there at 6, somewhere around that time, and you're gonna chunk a lot of coffee, and your nerves are gonna be stressed out. And when you're gonna walk into a lab, you're gonna see a lot of stress all around you. That's very common. I've been there. I know this. During Adex, you will see people oozing stress in early morning. And one of the key thing is you want to make sure you stay relaxed. So make sure you get some good breakfast, or at least chew a gum, drink a lot of water, listen to some music, and make sure you're calm. Because in anxiety, you're going to forget your passport or your identity card in the room or something like that. That happens. So make sure you keep yourself calm. Second of all, I would say this sounds funny, this sounds silly or stupid, but it has happened to people. People have failed their ADEX exam, their bench exam, because in a rush they didn't counted the right teeth and they prepared a crown prep or a class 2 or an endo on a wrong tooth. So if you're told to do a crown prep on tooth number 8 or 9, make sure you count the right tooth and prepare on that. Do not try to rush through that process. So remaining calm is very important. The other thing I want to tell you is that there are different type of typodonts. There's the Module Pro used in ADEX exam. There are Kilgo, there is Columbia, there is some other brands as well. And all of them has different hardness of teeth. And their contact points can be different. And sometimes you might be preparing on Columbia teeth, which has really hard contact point. And because you've been using that typodont, it might loosen up a little bit. But when you go to the exam, it might be really hard. And I can tell you from my personal experience, during my restorative ADEX exam, the typodont contact points were so hard that I couldn't put in a wedge. It was very hard. Even to pass a rubber dam through it, I was using a lot of energy, and I was wasting a lot of time, and that was stressing me out. And I had 3 cups of coffee, and my nerves were like getting a lot of, like I was getting a lot of anxious during that time. So one of the things I will tell you, that getting yourself familiar with the type of typodont that you're going to be using is good, but also remember that it might not be exactly the same, because the hardness of teeth might be different, or the contact points between the teeth might be more narrow and close, and it takes a lot of force to open them up. And sometimes people break the teeth while trying to put a wedge between the teeth. So be careful about these things. Mentally be prepared that the teeth might be a little bit different. Other thing I would suggest you is that being gentle and nice to the gingiva, because people who have done practical crown preparation on human beings, you can, even if you nick a little bit on the gingiva or had to cut some tissue, it's going to grow back. But in a bench exam, if you do that, that's a critical error. And one of the things I'll tell you for ADEX, read all the critical errors. What are critical errors? Because you should know what an ideal prep should be for a gold crown, what for a PFM. You should know how much occlusal reduction is required and what's the ideal limits, because because you might be able to do a really good prep, but if you can't evaluate yourself and you can't say, okay, this is the thing which I did wrong. Maybe you nicked the adjacent teeth a little bit. If you can see it and you can evaluate your own self, that that's what makes your practice good. So every time you practice, look at that criteria, Adex licensing criteria, and see what you're doing wrong. Like, is there something you fell short? And sometimes we do nick the adjacent teeth. That's common. It happens. Make sure you don't make a big ditch in the adjacent teeth. If it's a small roughness that happened, you can always use a shofu polishing burr or some kind of polishing strip and just polish it out. That's still fine. But be careful about nicking or making a big ditch in the adjacent tooth. Sometimes using interdental, uh, what do you call, like a interdental guard, interproximal guard, using those can help you save the adjacent teeth. And being nice to the gingira is very important. One other thing I'll tell you, whenever you do a crown prep, whenever you do a class 2, make sure it's clean, make sure there's no debris on it, make sure it looks shiny on the typodont, because you can use some abrasive strip or a polishing burr, and make sure there's no sharp line angles, no pointy angles, because imagine if you're making a crown prep and you have pointy angles, the crown can break on top of it. So you can make sure that there's no sharp edges by running your finger and using an abrasive strip or a uh, polishing burr, something like that. But you have to be careful, like do not use too much force. One other point I'll tell you, if you're sitting in a practical exam and you feel like you're using a lot of force to cut the tooth, well, maybe it's a good time you change the burr. Sometimes these teeth can be hard, and if you feel like you're using a 330 burr or a diamond burr and you're using a lot of force, well, you shouldn't be. That means that you need to stop, either change the burr, and I'm not saying to waste burrs. Those are expensive material. Be careful, but do not use force, too much force, because you will be burning out the tooth. You will see brown kind of scarring, or you are burning the tooth against the burr. So from my experience, one of the things I've learned was not using too much force. That was a thing that helped. Other thing that I can mention to you at this point about my experience of giving ADEX exam is that you don't run out of time. You have enough time, but if you're anxious and you're in a rush, you can make some stupid mistake. You can nick adjacent teeth, you can break a teeth, you can end up prepping a wrong teeth, and most of these mistakes happen because people are too stressed out and they just make mistakes. So you can decrease a lot of your mistakes by making sure you sleep well, you're relaxed, and do not accumulate stress from other people. So keep yourself calm. The other thing is practice. Practice a lot. Make sure you practice every day and have good mentors or people that can see your prep and give you some feedback. And use putty stents. See the occlusal reduction. Make sure you know what a secondary bevel is. Make sure you know how to keep your margins smooth. Make sure that you don't have a ski jump or a lip in the interproximal areas. These are some common things that happen, because there might be something there might be something which is not 100% in your prep. But if you know and you can evaluate yourself that, okay, I nicked the adjacent teeth, or I had a ski jump, or my margins were rough, and you can point out your own problems or your own shortcomings, that shows that are a well-informed or an educated person regarding those procedures, because I know what an ideal looks like. and maybe I fell short a little bit, and you can do a good self-evaluation. So I would strongly suggest three things. Make sure you spend a lot of time practicing. Second of all, make sure you get good feedback from some mentors. And third, you should be able to give a feedback to yourself, or you should be able to judge your own preparations, your own class tools, and see where are you falling short. And these are some of the things I hope help you in your preparation. And I wish you all the best in your journey. And hopefully, I'll see you in a more meaningful video. Thank you.